Well, go ahead. Please go ahead. Yeah, here.
Yes. Will a copy of this be available?
Sure, absolutely. Yep.
How do we get it?
I will, if anybody wants a copy, here. If anybody would like a copy, please just send me, if you don't have my email, come and see me, and I'll give you one of my cards with my email, and I'd be happy to send you a copy of the presentation. Yeah.
Halton Region has a tax deferral, property tax deferral program
Okay.
that Burlington also subscribes to. So you can defer your property taxes.
Oh, super.
For low-income
Oh, great.
residents.
Oh, okay.
And more information is available on the Halton Region website.
Oh, awesome. Excellent.
Yeah.
Oh, that's great.
And so Burlington is part of
Till
that
you move
Yes,
program.
yes.
And so
Till you move
it's
out.
a great benefit.
If you sell the house.
Excellent.
and
Thank
pay
you
the
very
taxes.
much for sharing that. Did everybody catch that? That's really good
Comes out of
information. Thank
your
you. That's
equity in your
good.
house when you sell it.
Sorry? Yeah, no, I did, yeah. Absolutely, yeah. Okay, good. Thank you. I'm going to turn it over. Let me first of all introduce Anthony. Anthony was recently named as our new president and CEO of CARP nationally. He's been with CARP for about 16 years and is extremely passionate about CARP and helping seniors better their lives. I'm going to turn it over to Anthony.
Thank you.
Okay.
Thanks very much, Bob. If I could get Roland maybe to come and work this computer here, where I just push the slides, keep me in line. When a chapter has the energy and the interest to do something like this, to poll your members, to figure out what's on the mind of your local membership, and then take that message to the elected officials who rely on you for votes. That's super important because they know you're paying attention. And what CARP chapters do across the country is hold them accountable in a way that's a little bit more than a general audience. These are voters and their constituencies. And when you go see Stephen Crawford and Effie provincially, or you go see Karina Gould, if she's still the MP here, you'll see the federal MPs. That really holds sway. Now, I will ask you to go back to Stephen Crawford and say, listen, this isn't an issue for the Ministry of Seniors. Ministry of Seniors is, from my point of view, a pat on the head ministry where they say, we're listening to seniors and we're investing in programs so you can gather, but they're not making the changes in healthcare and financial security that are required. So push back a bit on deferring to the seniors ministry because it disappears there. We need the finance ministers and the ministers of health to make the changes.
Terrible.
So
Yep.
thanks for doing that, and thanks for everyone who participated. My name is Anthony Quinn, not the actor, and I have been working at CARP for 17 years.
Oh, 17.
And working for the chairman of CARP, who is Moses Znaimer, for 26 years. I started off as an intern in his office after doing a postgraduate program at Sheridan College in journalism. And I thought I wanted to be a videographer for City TV or Much Music or something like that. But I ended up working for Moses for a decade or more. And when he became the chairman of CARP, I saw that as an opportunity to get out of that sort of news and entertainment direction I was going, understanding that was about selling advertising, and going over to the CARP side and really hoping and helping to change the direction of Canada. And the 17 years has been incredibly rewarding, and I'm very thankful to have this position now as the president of your association. So I hope you'll continue to support CARP and what we're doing. Roland, let's get this show on the road. For those of you, I did want to make an introduction myself. I was promised that we'd have 2 representatives from the Niagara Region chapter here, but they may have been held off due to the weather. They're not here. But we do have a VIP in the audience from the Halton Police Board. And if you want to stand up there, Naveen. This is Naveen Akbar. He is a representative on the Halton Police Board, and he's here to find out what's going on, what's on the mind of seniors, and I'm glad he had the chance to hear from your local report in Halton, and I'm going to dig in a bit more on the issues of financial security. So thank you for coming this afternoon. I know it's a crazy day to be out in traffic and weather, and thanks for everyone. So thank you for coming, and he'll be willing to talk to you during our break. I'm going to break my comments up into two, so you can talk to our partners and our vendors and talk to Naveed as well. So thank you very much. Okay, yeah. Okay, for those of you who aren't intimate with the history of CARP, we started in 1984, celebrated our 40th anniversary recently, and we have about 250,000 members across the country. 2/3 are in Ontario, because that's where the association started and has spread across the country, but we have representation and members in every part of the country. I'm always interested. I also run the CARP call center, so people are calling in from across the country, and I help to manage the call center. And when someone calls from Yukon or Nunavut, and I'm really interested to understand that the issues that members are experiencing across the Canada, while sometimes they're unique, they are often similar, and that's where we see trends, and that's where we try and focus what we're doing to make sure we're solving the problems that are on the minds of most older Canadians. Nonpartisan and not-for-profit. The nonpartisan thing is the hardest when we have a pluralistic membership base. If we do something that is seen to be talking to the Liberal Party, Conservatives get mad at me. If I talk to the Conservative Party, the Liberals get mad at me, and the NDP is getting mad all the time. So the idea that we are nonpartisan is the most important thing of what we do. We're not like another seniors organization that you might be part of. Let's say you're a retired nurse and you're a member of the Retired Nurses Association. That association has a mandate to protect the pension and the interests of retired nurses. They will take on some other issues, but they have a mandate outside of general advocacy. And the nonpartisan nature of what we're doing is intended to make sure that all Canadian seniors are engaged in what we're doing, and that we represent the interests of our members regardless of their political affiliation. And what we ask our members to do, we don't tell you who to vote for, but we say all of the issues that CARP is advocating for are universal, and every political party should be working in their own way to solve these problems. So if you vote red or blue or green or orange or things purple now as well, if you want that candidate to be in power, we want you to hold your vote close to your vest and to say, here's the issues that are important to me. Please put them on your platform. Please promise to solve them, but you don't get my vote unless you commit to do that, regardless of the party you want to support. Next one, please. So here's the recent mission, vision, and values that we went through in our strategic planning session a year and a half ago. But the big thing to take away from this is that we want to influence public policy, and the umbrella that we see that is negatively affecting older Canadians is the umbrella of ageism. Almost all of the issues that we tackle in advocacy and policy changes are related to a societal view of Canadians as they're getting older. So whether it's financial security or healthcare or transportation or housing, there is just this layer of ageism that covers almost every issue. So that's something to keep in mind, and we're delighted to see that idea that ageism is an acceptable point of view in society is being broken down. We say it's the last acceptable form of discrimination in society, and we're working hard to eliminate it. Next, please. Might get you to pop that down. So when Bob showed the numbers related to healthcare issues, this is why there is I believe there's a current healthcare crisis. It's not visible unless you're in the system, but it's already started, and it's because of the numbers. Baby boomers, there's 7.8 million Canadians over age 65 right now, and in the next 12 or 13 years, we're going over 10 million. And that increase means that the infrastructure of Canadian society will have to provide the services that this massive baby boomer bubble will expect, but they haven't prepared in advance. If you're a baby boomer and you were 7 years old in Ontario, the province was scrambling to build elementary schools because there was too many of you. And then they were scrambling to build high schools and community centers. And all the infrastructure you see in these communities comes from the late 60s, early 70s, except for some of the new stuff, because they were building these infrastructure things for you. So there was no secret that this demographic was here, that it was massive, and that it was coming. But what has happened is that politicians of all levels and of all political stripes kicked the can down the road so far that we are falling off that cliff when it comes to providing for your healthcare needs. So I'm not talking about healthcare tonight, but that problem is so imminent and so massive that only that home first approach to healthcare and prevention can meet the demand. And I'm envisioning a situation at your local ER where there's a lineup of people going into the ER for triage, and it's 10 or 20 or 30 to 1 seniors, and there's going to be a mother with a young daughter who has a fever, and she'll be waiting in the same line saying, why is my daughter not getting care? And they'll want to blame older adults for having a condition that needs emergency care. And it's not because the seniors are doing anything wrong. The issue is that the system hasn't prepared. And I'm trying to fight this idea of an intergenerational battle for services, but also to impress upon the government that necessarily the healthcare system will be under pressure because there's so many more baby boomers. The oldest baby boomer is 80 years old this year, and all of these baby boomers are going to have the exact same conditions and healthcare needs that the generation earlier had. There will just be so many more. If there's 10,000 falls that lead to need for hip surgery, that number will grow, not because there's more falls, it's just because there's more people falling. And that's going to include dementia and Alzheimer's and COPD and diabetes and all the things that come along with aging. So prevention is the only method we have. So just, I think, the last slide to explain what CARP has done over the 40 years. And so the seniors as a group have this wisdom where they're advocating for themselves, but they're also advocating for future generations of seniors. When Canadian CARP members 30 years ago advocated for a arm's length pension plan so that the Canadian government wasn't using your CPP money as part of their general revenue, that was Canadians, seniors advocating for future seniors, not for themselves. And when we worked to eliminate mandatory retirement at age 65, which was one of the biggest wins in the fight against age discrimination, it was seniors who were already over 65 who were fighting that fight. It wasn't 45-year-olds. They didn't see the future. They were thinking about their own pressures day to day, but it was seniors who changed that rule for future generations of seniors. It was less than 20 years ago, 16 years ago when, pardon me? 2007. So we're coming up on 2 decades, but you were walked out of your office or your place of business or the factory or wherever you worked when you hit 65 maybe a pat on the back, a little cake, and a watch if you were a white-collar worker. But generally, you had to leave whether you wanted to leave, whether you were still contributing to your company, whether you could afford to retire. And that has changed, and really CARP's efforts have flipped that on its side. So really important programs that CARP has brought for you today as seniors, and we need you to continue to fight to protect them for your children and your grandchildren, but also to understand that policymakers have their heads turned quite easily. And if they see that money is being spent on seniors and we're not appreciative of it, we're not fighting to maintain it, they will have their head turned by another group or advocacy or a voice or a collection of people and say, why don't you take that money from this pile for seniors and put it over in this pile? So we have to protect those wins. Next, please. So here's the issue that I want to put on your radar with a big siren flashing red. There is a movement in Canada right now looking to change who and how much Canadians get in old age security. Old age security right now is responsible for bringing seniors out of poverty from a level of 20+% in the 1980s to closer to 6 to 10% today. When CARP advocated for increases to old age security, there was no real valuable pharmacare plan that would pay for your medications. There was very low social safety net for seniors. The CPP wasn't as buoyant as it is today. And Canadian seniors were choosing, in many cases, between heating their home and taking their medications and shopping at the grocery store. So old age security has played a tremendously important part in elevating the lives of Canadian seniors. What's happening right now is there is a gentleman, I use that term, no, he's a gentleman, but he is a professor at the University of British Columbia. His name is Paul Kershaw, and he runs an organization called Generation Squeeze. And he purports to represent younger Canadians who are having economic difficulties. Not that you didn't have economic difficulties when you were younger, but he is framing this argument as a zero-sum game where he says all of the problems that younger Canadians are having are because the baby boomers are hoarding the wealth, they're hoarding the housing, they're taking old age security, and all of that is money that should be better spent on the interests of younger Canadians. But when he says that, he means his own political interests, his own ideological interests. So he's pitting generations against each other in a way that is causing this intergenerational mindset to start to blame seniors for the economic problems that younger Canadians have. Roland, let's see what we got on the next slide there. So this was a headline story in the Globe and Mail, but this was from 2022. It says, sorry grandma, we're cutting your benefits. Now they say that no politician would say it, but they should. And this has been the mindset of the editorial board of the Globe and Mail for at least 5 years. The idea is that seniors, by definition, are rich. Seniors are entitled to old age security that they don't need or require, and that Canada should switch old age security. Next, please. So the argument from CARP's point of view is that their argument is false. They framed this as a zero-sum game, that if you take money from seniors and give it to their programs, that everything is going to be solved. CARP argues that economic policies from the federal government should raise all boats, and that they should be working to establish housing and careers and daycare and all the things that younger Canadians are looking for, but not at the expense of older adults. they often frame it as seniors being takers, but they don't mention the billions of dollars in property tax that you're paying, or the billions of dollars in GST and HST that you're paying into the federal government. And certainly don't take into account all of the work and the effort that you've put into building the communities in which they are now living. So they discount all of that and frame it as a zero-sum game. They want to take from retirees today, but do nothing to fix the problem other than move money from one side of the ledger to another. Next, please. So Dr. Paul Kershaw, he says that seniors are draining healthcare and housing from the young. And while CARP is advocating for an increase to old age security for those age 65 to 74, they're saying let's cut it entirely. And I mean cut off the thresholds, switch the calculations from individuals to households, and generally eviscerate this old age security program. Next, please. So here's another headline in the Globe and Mail to show I'm not making this up. This is regularly occurring. This one's from 2024. It's time to retire subsidies to rich seniors. And this is how the headlines are getting the attention of the media and of policymakers, because they're framing seniors as rich because they might have a bit of a pension, because they get OAS, because they have CPP. And if you have a household income now, what they call rich is $100,000 of household income. Now that does sound quite like a good number, but if you have a $100,000 household income and you require a retirement home, one of these terrific retirement homes, those are running between $5,000 and $12,000 a month, depending on the level of care you need. So $50,000 individual income is not a rich senior. And they're being very disingenuous in their description. Next, please. So the real issue, as I've stated, is that the government has failed to plan. They've kicked the can down the road, and there is this noise coming from a government-funded university think tank that gets money from the Canada Mortgage and Housing Corporation, that has money coming from the university, and is also operating as a charity, surprisingly. And they're giving cover to politicians to cut old age security. And CARP is drawing a line in the sand. We'll go to the next one. And we're saying there's no way we can allow that to happen. Nearly half of single seniors, we talked about single seniors, rely on OAS for close to half of their income. 12 million Canadians will now retire without a pension. Those things don't exist the way they used to. Seniors' poverty will rise, and if we weaken old age security, it'll push thousands, hundreds of thousands into hardship. Next, please. So CARP is asking for nothing more than the social contract that was promised to seniors. We are asking them to keep old age security eligibility at age 65, and the argument would be to create greater incentives to defer your OAS to 67 or 69 or 70, like they do now. No new clawbacks from the existing thresholds, to extend that 10% increase, and to strengthen the survivor benefits. So we know that when you lose half or more of your income as a senior couple, particularly if it's the male in the couple dies, the costs of living don't cut in half as well. You're still paying the same mortgage or rent, and your heating costs are still the same for your home. And we need to improve the needs of those Canadians. So this is how Generation Squeeze is fudging the numbers. Right now, the headlines say a rich couple can earn $182,000 and still receive old age security. And then they say, well, we can fix that by making it $100,000. But they switch that number from $182,000 to $100,000, and the idea is that it's now based on your household income rather than your individual income. That means two retirees earning $50,000 could see their OAS cut substantially, if not completely. And if you are one of those recipients of old age security, you realize that $8,000 or $9,000 per year doesn't go that far in today's economy. The clawbacks right now start around $90,000, and by the time you get to that highest threshold of $148,000, you've had it all clawed back. The point that the newspaper headlines and Generation Squeeze never mention is that only about 4% of Canadians over 65 are in that level. So they're framing this as millions of seniors, rich seniors still getting OAS, but very few actually have that number, and the promised savings that he says we have would only apply if we start cutting middle-class seniors' old age security. Generation Squeeze has now put together this program where they have seniors saying, I don't need the money, take it, they should change it. That's great for them that they don't need the money, but we think that old age security is such an important part of Canada's retirement plans that we can maintain old age security but still close the loopholes. So right now there are many, but not millions, of really wealthy seniors who take advantage of the opportunity to collect old age security by tailoring how much income they show on their taxes to the point where they get the maximum old age security. And I'm not talking about real estate wealth. Let's say your house happened to increase in value from when you bought it at a very modest $90,000 or $150,000, and now it's worth $1 million. That's a risk you took in buying it. But I'm not talking about that kind of wealth. I'm talking about wealth where you have liquid assets, investments, cash, and you only claim that $80,000 or $90,000 in income, generating an extra 10 grand in your pocket every year. And if you're a couple, $20,000. CARP isn't advocating for rich seniors to have gas money for their boat every summer that they can take advantage of. We want to close those loopholes, and we don't think it'd be much effort on behalf of the CRA to close those loopholes and not have financial advisors telling their clients this is how you can make an extra 9 grand every year. But close the loopholes, but not eviscerate the entire program. Next, please. So just to close on Dr. Kershaw, he has some other bad ideas that are getting traction, and one of them is to tax your home equity. So if you're a homeowner and you're living in a house that is, again, let's say we'll use $1 million because houses have gone up in value, he wants to tax you annually on that value of your home. So you might owe $3,000, $4,000, $5,000 every year as a wealth tax for being so successful in your home ownership. And he wants to take that money for his own interests. And if you sell your primary residence and you're downsizing or you're moving to a retirement home, he also wants to add a new tax on the sale of your primary residence. So these again are very bad ideas coming out of this. I imagine it's a few offices at the University of British Columbia. But the Globe and Mail is spending a lot of money on ink, I guess digital ink now, giving them attention. And I'm concerned that the government is listening to this, and we have to make sure we avoid it. Next, please. Oh, so this is what they're putting out. And I'm going to bring the microphone to, you can hear my computer. But this is the seniors that they have brought onto their team to say, hey, I don't need the money. And I just want to show you the ads that they're putting out on the internet. Oh, go back one. It's there somewhere. Well, maybe I can't do it. Looks like it didn't transfer in the PowerPoint. But they have a campaign now of a handful of seniors saying, listen, I'm doing really well, I don't need the money. On your CRA form every year, you can give them back as much money as you want. And so we want to fight against that changes and fight that idea that Canadians, seniors, cutting off the OAS program is the solution to Canada's problems. Poor planning has actually been the villain. The government ignored the demographics. They failed to build the housing supply to match the immigration and the aging population, and they're now scapegoating and allowing this scapegoating to take place to dodge accountability. Next, please. So you paid a lifetime of taxes, you raised families, you built Canada, you're still contributing. Older Canadians, I think, care the most about younger Canadians. They care the most about their children and their grandchildren, and they want all the best for them, but not at the expense of cutting into their retirement security and dignity. And I'm referring to Dr. Kershaw as a bit of a Robin Hood. He's taking from what he perceives to be rich people and giving it to what he perceives to be poor people. But the poor people in this case are younger Canadians who are still starting out, who have a lifetime ahead of them, and he wants to take it away from older Canadians who have a shorter runway and need this support. Okay, next. Is there a next slide? And I'm going to break up my conversation into two parts so we can take a break and talk to me or ask any questions of our guests here today. But the message is hands off old age security, and what I'm asking you to do is to pay attention to what's happening around you in the media, because they are gaining traction as seniors are as maybe ambivalent or unaware of what's taking place in the back rooms in Ottawa and in these think tanks. And we have to be prepared to just say no and hands off old age security. So I'll stop there and happy to answer any questions on the break. Please, how long is the break going to be?
20 minutes.
20-minute break. Please don't run away.
Take 10 bars.
Have some refreshments.
10:30, because we're
You'll have to
done by
hear more from
8:30,
me shortly.
We're
But
only done by
what I'm going to talk
8:30.
about next
Okay.
is
Maybe say
even
10.
more concerning to your financial security, because we're fighting with the banks. And I want to tell you about that fight with the banks.
Anthony,
Thank you.
10. We'll take
10-minute break.
10-minute break.
10-minute break.
Okay. Yes, it is, Barbara.
Yeah. Let me turn this off.
Yeah. Yes, so.
So what I'm going to do is phone my MP, send a little note to them.
Sure.